Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Monday, August 11th. Here are our reporters with what we're covering today.
A $3.3 billion deal in home health gets the green light, and it's going to change competitive dynamics across the country.
ACA premiums are set for a steep climb next year. I'll tell you why insurers are asking for so much more.
One rural health system just rolled out AI in every patient room, and it's fully integrated with Epic.
Omada Health posts big revenue gains in its first earnings call as a public company.
OhioHealth is investing $31 million in a brand new, round-the-clock care center.
And at the end of today's episode, a reflection from my LinkedIn network on the courage and resilience of CDC scientists in the wake of tragedy. You won't want to miss it. Our first story: a major acquisition is moving forward after months of scrutiny. Logan Stokes has more.
United Health Group and home health provider Amedisys have reached a federal settlement to move ahead with their $3.3 billion deal. The agreement requires divesting 164 home health and hospice locations in 19 states to address antitrust concerns raised by the Federal Trade Commission. Those locations will be sold to a third-party buyer approved by regulators, ensuring competition remains in affected markets. Once finalized, Amedisys will join United Health's Optum Health division, expanding one of the largest home-based care networks in the country. The deal reflects the growing push by payers and integrated care companies to manage more care outside hospital walls, a shift that could change referral patterns, tighten post-acute capacity, and pressure local providers to partner or compete.
So Logan, what does this mean for hospital executives watching this space?
It's another example of vertical integration accelerating in healthcare. Systems that rely heavily on home health partnerships may need to reassess their strategies as United Health builds even more direct-to-patient capabilities.
Now to the insurance markets, and some troubling news for affordability. XAVIER Banks has the details.
A new analysis from KFF shows insurers are proposing a median 18% premium increase for Affordable Care Act exchange plans in 2026. That's the steepest jump in nearly a decade, and 11 percentage points higher than last year's requests. Insurers point to several cost drivers: rising labor costs across the healthcare sector, higher spending on breakthrough but expensive drugs, especially GLP-1 medications and certain gene therapies, and an uptick in overall utilization as patients return for delayed care. Another factor: the expiration of enhanced premium subsidies that have helped keep consumer costs lower in recent years.
And so, what's the takeaway for health system leaders?
It's a potential shift in payer mix. Steeper premiums could push some patients out of the individual market, increase bad debt in charity care, and drive more uninsured patients toward hospital EDs. Executives may need to adjust financial forecasts and consider expanding patient assistance programs to offset the impact.
Coming up, one rural health system is going all in on AI for every patient room. More on that after this.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
One rural health system is going all in on AI for every patient room. JADE Romero has the story.
Reed Health, a community health system in rural Indiana, has completed one of the most comprehensive AI deployments we've seen in a non-urban hospital. Every inpatient room is now equipped with HelloCare.ai, an AI-assisted virtual nursing platform that integrates directly with Epic. The system allows nurses to monitor patients, respond to requests, and document care remotely, freeing bedside staff for more complex needs. It can also guide patients through self-care steps and provide education in real time in multiple languages. Hospital leaders say the move is part of a long-term workforce strategy designed to address staffing shortages without compromising patient experience. Early pilots showed improvements in call light response times, reduced readmissions, and higher patient satisfaction scores.
That seems like a really bold move, Jade. Is this kind of rollout realistic for other systems?
It is, Steve. It just depends on capital resources and IT readiness. But Reed's success shows that even smaller systems can leverage AI to extend workforce capacity if leadership commits to integration and change management.
Now to digital health and some strong numbers from a newly public company. JALEN CROSS joins us.
Omada Health, a virtual care provider focused on chronic disease management, reported $61 million in second quarter revenue in its first earnings call since going public in June, a 49% year-over-year increase. The company's platform combines human coaches, connected devices, and AI-driven engagement tools to help patients manage conditions like diabetes, hypertension, and musculoskeletal disorders. Growth in the quarter was fueled by expanded contracts with large employers and health plans, and by adding new condition modules for mental health support. Omada executives say they're now serving more than 1 million enrolled members nationwide, and early outcomes data show reductions in hospital admissions and ER visits among high-risk patients.
That's a clear signal that digital therapeutics are maturing. JALEN, what's the bigger picture here for hospital leaders?
Omada's results signal that virtual first chronic care is gaining traction with payers, and it's not just for primary prevention. Health systems may need to explore partnerships or competitive offerings to keep patients engaged and avoid losing downstream service revenue.
And we finish our news rundown in Ohio, where a major new healthcare facility is on the way. TERESA VAUGHN has the details.
OhioHealth is investing $31 million to build a 40,000 square foot healthcare center in Canal Winchester, a growing suburb southeast of Columbus. The facility will offer 24/7 services, including urgent care, primary care, imaging, lab services, and specialty clinics, all under one roof. Construction is set to begin later this year, with more than 50 jobs expected to be created when the center opens. Executives say the project is designed to meet rising demand in a rapidly expanding community, while easing pressure on OhioHealth's nearby hospital campuses. The move reflects a broader trend in healthcare delivery, shifting more services into off-campus, accessible locations that capture patient volume earlier in their care journey and improve convenience.
That's another example of systems looking beyond the hospital walls to capture market share. TERESA, what does this mean for other systems?
It's a reminder that strategic outpatient expansion can be a growth driver and a defensive play. Systems that delay may lose market share to competitors who meet patients where they are.
Before we wrap up today's show, I want to share a reflection someone in my network posted that captures exactly why we do what we do in healthcare. On LinkedIn, Gil Bash, a respected healthcare communications leader, turned the national attention back to the scientists at the CDC, reminding us that these people aren't just data points, they're human. He shared how the recent shooting outside the agency did more than damage buildings. It shook the very hearts of the scientists inside. Bash highlighted something quite powerful. It was the way that the CDC staff responded, with calm, courage, and a renewed commitment to protecting public health. It's a reminder to all of us that healthcare isn't just about systems and strategies. It's about people showing up, even on the hardest days. That's a kind of bravery we should all carry into our organizations. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Verado. Verado powers exceptional experiences everywhere by solving the problem that drives everything else, knowing who is who. Verado, the first name in Who's Who.